how to build up your practice? Are you confused what to do and where to go? If yes, hi, I'm Dr. Apurva Kadam Thakkar from Team Joints and Motions, and today we have with us Dr. Sudarshan Singh, who is a physiotherapist, who is an entrepreneur. He is a certified osteopathic and chiro practitioner, and he has more than 20 years of experience in our field of practice. So, hi, sir. Thank you for your valuable time. And he's taken out time for us to understand, to help us understand how do you build a practice in physiotherapy. So we have few questions lined up for him. We have gone around and asked young physios about how to build up the practice. So, so for you, according to you, what is the best advice that you had received from your mentor or fellow colleague which helped you build such a good practice?
Hi Apurva, and a big hi to all the Joints in Motion followers, and thank you everyone for joining in for this live session. Talking about advice to the young physios, I think the young physios are in a great mood to kind of prove themselves, get a degree. So they just want to kind of run behind treating patients or probably understanding what is the best kind of revenue that they make. And I feel that as a physio, at least the first 2 to 3 years, you need to build your ethics in the right way, because these 3 to 4 years are very important for you. When you see your patients, you need to understand these patients will come back to you, and there is a reason where they may not come back to you. Okay, because let's say if you don't have the right sort of approach, whether it comes to listening skills, whether it comes to understanding the history, or whether it comes about handling the patient, if you don't have the right skills, here is where the patient can feel that you're not that good, and because of which you may lack this kind of practice. So I feel it's important that you build your ethics in the right way. Whatever you have learned in your whatever you have learned in your college, and whatever you have learned in your internship, you don't have to get completely out of that way and do something very bizarre. Just start working on that. Just start doing that in the right way. Obviously, you have seniors around you who teach you every second, every minute what to do, what not to do. So follow that for sure. But at the same time, don't be too focused about how many more patients can I see, or how can I, kind of create a huge impact. These impacts do happen, but it takes a little bit of time. So I think building your ethics is one thing that's very important for all the young people.
As you said about having and taking advice from seniors. So having said that, how will we connect with those seniors, and how do we build a network with those seniors?
I think these days you're open to a good amount of networking, whether it is even WhatsApp groups. A lot of local physios have their own WhatsApp group. For that matter, you have so many open forums, whether it is Instagram or even Facebook, and a lot of other social media sites where you can actually connect with anyone. I get to connect with a lot of physios when they see my profile or when I see their profile, and we get to exchange a lot of things. So I think these days connections is just not an issue, and it is equally important that we don't have to feel that okay, just because this physio is somewhere around me, or he stays somewhere around me, he's my competitor. I don't think that should be the attitude. You should always look at having a collaborative effort. You should always look at having something where probably two of you getting together, you could do something better. So maybe you have to think from a constructive perspective rather than thinking that he's my competitor, so I'm not going to talk to him about my patients, or I'm not going to talk anything about in this way. So that's not the right spirit. So I think there's someone asking whether we can ask questions. Harshi, if it is related to physiotherapy and physiotherapy practice, yes, you can put up your questions, and if we have time by the end of the session, we'll definitely answer.
Moving on, how do you mentioned about joining and connecting with Instagram or Facebook? So how important do you feel is connecting on these networks and using the technology in our advantage for networking within physiotherapy?
I think it is really important, because when you connect with the physio, you understand their practice. You understand how they are working. Of course, you may have your own way of working, but you tend to learn a lot of things. So I think that's really important that this is something which is followed, where you also understand what is their way of working, what is their way of treating. If there is something that you can learn from
So
them,
as you,
and there's no
as
harm.
Sir is saying, we understand that learning from somebody even after we have completed our degree is not something that we should be ashamed of, because we learn so many things but we lack so many things which we do not get to learn in our colleges. So learning from a resourceful person and adding to our knowledge is very important in the initial first years of practice, along with following good ethics so that the patient stays in connect with us and keeps following back with us. So uh,
Yeah, I think you should still continue. You should still continue to see yourself. I mean, a medical professional is always learning, is always on the path of learning. So, obviously, and especially after the first 3 to 4 years of your learning, it's very important that you meet the right kind of physios. You see the right physios who are building the right thing for you. You know, because when you start following them, you know that whatever you're doing is right. So that's very important. And these 2 3 years are very crucial, because what you learned, that 4.5 years, what you learned in your physiotherapy course,
yes,
it is definitely quite limited, and the clinical approach is very different. The clinical world out there is really different. So when you learn from senior physios, when you see them working, when you see them talking to people, when you see them how they manage patients and how they talk to them, I think all these are aspects of learning. And that's why I said that young physios should spend time, whether it is a clinical practice or a hospital place. They should definitely spend time trying to still learn in their first 2 3 years.
so there are a lot of things that we did not learn in our UG colleges. So say about there are techniques which have come up like cupping, MFR, taping, facial distortion model. All these different terms we keep hearing them. How important do you feel is that we learn and do all the certification courses, and when exactly is the right time to do these courses?
See, this is equally important. Your workshops are very important. But what you need to understand is that don't just go and do a workshop because your physio friend is doing that. Okay. You both have a different level of interest. First, what is important is that you need to understand what is the level of interest. Whether you are into musculo, whether you are into neuro, and attend those workshops accordingly. Okay, I have seen a lot of physios. What they have done is, because cupping has become very common nowadays, because dry needling has become very common nowadays. Every second patient that I see, they would tell me, we did cupping, we did dry needling, but it is still not working, and now we have come to you. So the point is that don't just do these things because it is it is just in the process, or it is contemporary. Okay, what you need to understand is, what is your interest? Do you really like cupping? Do you want to really learn more about it? Do you really want to understand what conditions it is used in? So become a cupping specialist. Okay, that will show up your niche. That will show, as a physio, you have this particular niche. But at the same time, it's important that you give results over there. Okay, and you don't have to make a mixed bag of everything. You don't have to do cupping at the same time, go for a facial distortion workshop. I mean, how is it relatable? How is it linked? Do you have any sort of therapy tech or techniques wherein it is linked to each other? If it is not linked, you are probably just in the rat race of doing every next workshop that you see around. Because I see this insecurity, a huge amount of insecurity with a lot of physios. In fact, I have done a few workshops, and the best topic that most of the physios have when they are free is, have you done this workshop? Have you done that workshop? My concern is, have you really tried to build your practice around that workshop? Now that's very important, because you spend an extra few bucks, trying to learn something. Now, if you have not actually applied it in your regular treatment, or if you have not applied it in your regular practice, that workshop is a complete waste. Okay, I see a lot of second year, third year guys doing workshop. I don't think it is logical for them to do workshops at this stage, Because frankly speaking, if a final year student, if an intern comes to me and tells me that okay, I have done these workshops, I'm sure they are not hands-on work for those workshops. Because let's say if they have done a workshop in the fourth year, and after that they have to actually work on their final year, they have to work on the internship, and all these things cannot be done there. So it's important that once you get your degree, clear your degree, then understand few things, take a call, and try to pursue it in a strong way. You should also look at it that I will not just do cupping, but also I will do a lot of other areas which involves cupping, or probably have a niche completely in cupping, whether it is dry needling, whether it is cupping, whether it is MFR, all of these things, because these are, in a way, if you say these are connected, but I don't see why physios are individually doing it in the first place, and everybody is just doing their own. And end of the day, patients are not getting the kind of result.
So by this, that we mean to say that we just don't need to do cupping or MFR for the sake of doing it, but we need to do it so that we help for the betterment of the patients. So we can combine two techniques or two treatments so that and see what best works best for the patient. Sometimes a patient may respond best with cupping, or he may feel that the pain is elevated. So you need to understand how do you decide whether you do this for that patient or no, and that depends upon the experience. So if you're not getting any experience, yes.
It's exactly like we also do cupping, we also do dry needling, but there are some areas, or there are some patients where we
Yes.
feel that yes, this is relevant and we should do it.
Yes.
We just don't go gaga about cupping and just keep
Yes.
doing cupping for
Yes.
every
Right.
second patient who comes to
Yes.
us, whether it is relevant or
Like
not relevant.
understanding
That doesn't
how
make sense.
important and relevant it is very important. Yes. And a lot of young physios have asked me to ask you how important is it to pursue masters or immediately after completing their undergraduate program, or is it important that they get first hand experience first for say about 1 or 2 years and then think about whether they should go ahead with masters or not?
Yeah, I think if you have to do masters, firstly you have to have a clarity about the interest. Whether you are looking for musculo, whether you're looking for neuro, and again, more than this, are you looking to do this clinically, or are you looking to do this, from an academic perspective? Okay, because if you tell me from a practice perspective, that doesn't make a huge amount of difference. Okay, but yes, hospitals prefer masters. If you are into an academic field, they always prefer masters. So if you're looking to do something here, you should immediately do your masters. You should not wait for your experience, because that is not going to make any difference. Yes, there are a few universities which have criteria. There are also a few foreign universities which have a criteria where they want you to do a 1 year master, or 1 year practice before entering into the masters course. But then if you're looking at basically improving your skill from any specific area or a niche, I think there are a lot of courses specifically involved from that perspective also. So it's not that you have to do masters. I see a lot of patients, I see a lot of physios who have done masters in community just because they got a seat, and now they want to practice neuro, or they want to practice musculo. So then there is a huge confusion. Either you didn't do enough research to understand what this community degree is going to do for you, or now you feel that you are nowhere. Okay, I see a lot of neuro masters in neuro. They don't want to do neuro anymore. They just want to do musculo because they don't find it that exciting. So either you didn't do your research well, or at this point of time, this seat is not going to make any difference for you. This masters is not going to make any difference. Yes, probably if you go to an academic field, you may end up getting a good degree. You may end up getting a good place in the next 5 or 7 years. Okay, but if you talk about practical areas like the clinical stuff, I think what requires is what we look at it is maturity. Whether the physios have the right kind of maturity where they can actually handle patients. Now, what happens is that when you have a bachelor, and if they have done a 2 to 3 years of experience, they understand the clinical area, they understand the clinical perspective, they understand the patient communication and all of that, and that eventually starts building around it. And the same thing more or less would happen with someone who's done a master's, though they may need some brushing in the beginning, but yes, eventually they do catch up. So I feel you have to be very clear whether you want to work in a hospital, whether you want to work in a academic setup, or you want to work in a completely clinical setup, which probably is something that you would do on your own. Okay, in all these three areas, what matters is if you are practicing in the right way, just develop your niche. You know, that's more important. If you're looking at clinical area, just develop your niche. You don't have to do a master's. You would probably end up doing a good 1 year degree, which is specifically related to your niche.
By this, we will want to say that we don't want to just do masters for the sake of it, or for getting a better job in a hospital setup, because eventually your experience also does count. You may get in the program because you're a master's, but what is your experience also does count. So this is what physios lack usually nowadays, that they see that masters karke I'll get a hike or something. So focusing on money part of it is actually not that valid in the initial first few years, because our skill set and our value depends upon what we are practicing and how we are practicing. So you being a physiopreneur, we understand that you have started up a new course on how physios should build their network, and how physios should go out of their way and learn how to build their own practice. So could you just guide us on that?
Uh, it's not like they have to go out of their way to build their practice, but the idea is that you have to understand that though you are doing a clinical practice, at the end of the month you're accountable to everything. Whether it is your rentals, whether it is your equipments, whether it is your EMI, you are accountable for everything. Okay, so you need to have a plan beforehand. You need to have a plan as to when you take a particular place, what is the rental, what are the equipments that are involved, and at the end of the month, will you be able to make this kind of money where you can pay it up, at the same time save something for yourself. So if you talk about your early years, let's say about 2 to 3 years, I would not strongly suggest you to go ahead and just completely have your own clinic. Maybe initially you can look at working in association with the physio, so that your burden is relatively less. Build up your practice, go easy, and then once you're confident as a professional that yes, you have built that sort of network, you have built that sort of clientele, and this is the right time where you can go ahead and put up, and you also understand the market. That's very important. See, physios take about 2 to 3 years to understand what is this whole process all about. What is marketing all about? How do we understand the market? So it takes a lot of time. And because the problem here is that these things are not taught to us. These things come to us directly as experience. These things come to us when you actually make a mistake, when you actually realize that, oh, these are the few months where my patient clientele is going to be lesser. This is something which you realize after 3 years of this happening. Okay, so basically, what course I am running is related to a lot to this, where I'm giving a lot of clarity to physios, a lot of clarity related to business, understanding what is your practice all about, and understanding how you can give value. See, money is not a problem here. I see a lot of physios who charge a good amount of money, but at the same time, when they start giving the value in terms of that money is much lesser. Now that is where a problem arises. So basically, if you understand what kind of value you can give to your patients, money is not a problem. They will be more than happy to pay. So, and this is what your skill set or probably your initial years of experience is going to show you. It's going to teach you that how do you give value to your patient.
So adding value to your skill set and making the patient, content with the practice we are doing is very important. So not taking up much of your time, but being a fitness enthusiastic yourself, and what is your advice and how important is it that physios being in this area of practice themselves practice these exercises or themselves work on their fitness levels?
So, like, this is a very heart touching topic for me, because most of the time I am very disappointed whenever I see a physio let me tell you what I actually see is how is the physique. Okay, because being a physio, all we are doing is understanding and teaching exercises. Okay. Now, if I am not in a position to show you an exercise or even kind of give you a demo of that particular exercise, how will I be in a position to teach you that? Okay. How will I be in a position to put up that kind of trust in a patient that look, I'm not doing it, but this is good for you. Okay, so that I think is a problem. So I think here physios need to take their health very seriously. They should be even from an appearance perspective, whether it is male, whether it is female. Females have to be very strong. When it comes to because we need to understand that when we deal with hemiplegics, when we deal with patients who need a lot of neurocare, females have really to be strong, and this cannot happen if you don't give at least 45 to 60 minutes of your of time to your body. Okay, exclusively trying to do workouts, trying to be fit, trying to ensure that you're not overweight, or if you're overweight, make sure that you're losing weight. I get really disappointed when I see a few overweight physios, or when I see someone who's really like blown out of proportion and not working on himself, but definitely advising people what to do. I think that's something where we are not justifying our profession, because there are so many things which as an unfit person you will not be able to do. Okay. Now, if you teach the same things to your patient, I'm sure you're not teaching them in 100% way. So how are they going to learn it? How are they going to build their trust there? So that's a major problem, and I think we should walk the talk. You can check the physios in all other countries. You will see the first criteria. The first criteria that they have is the fitness that shows up, and this shows up. It shows up in such a way that your patient wants to be like you. The patient wants to be like the doctor. We should not be the kind of doctors who actually cannot move around too much, but they want to keep advising patients, because we are not giving them medicines. We are giving them exercise. We are actually following a principle, a process which is fundamentally more towards exercise and less towards medicine. Now, this is something which we need to prove it to the patient even before teaching them. So I think it's very, very important that physios should follow a fitness, routine and keep themselves fit. At least fit in such a way that they are presentable to the patient, and when they talk, the patient can trust them.
So, thank you so much for your time and for your advice. As we have learned a lot of things from you. So, building up your practice requires building up your ethics first. Building up your practice requires building up a good set of value. Adding value to your patient's life is important. Understanding that everything does not revolve around money in the initial first years, and building up a niche of your practice. Whatever you do, whatever courses you're doing, make sure you're just not doing it for the sake of doing it, but actually implement those in your practice and understand if it is adding value to your work. That is really very important. Understanding that just doing masters for getting a degree or a pay hike is not important. You have to understand that whether you're really interested in that line of practice. If you're confused, you should do some observationships, understand, make up your mind whether you really want to go ahead with masters in that particular area is very important. Lastly, it is really very important that you as a physio are fit and fit for advising patients to be fit. Because if you are not fit and a patient ko bol rahe ho thoda weight kam karo, the patient is obviously going to judge you. So understand that being fit and adding value to your skill set is really, really important. Thank you, sir, for your time. And if anybody